Happening now, more Americans are getting older, which means our healthcare systems must prepare to care for an aging population. CHI Health Clinics in St. Elizabeth Hospital here in Lincoln were recently recognized as an age-friendly health system. And here today to share what that means for us in the community is Dr. Mary Spivey. Thank you so much for being here today.
Yeah, thanks for having me.
All right, so what does this mean, this age-friendly health system?
Yeah, so an age-friendly health system is one that really focuses on improving the healthcare of older adults. So about a year ago, Common Spirit Health, who is CHI's parent company, chose us in Lincoln as the CHI Health Clinics in St. Elizabeth to be the pilot program for the age-friendly prior to expanding to other locations within their healthcare organization. Due to that, for the last several months, we've been working on incorporating healthcare evidence-based practices that have been shown to optimize patient outcomes, improve the patient experience, and cut costs for our patients, which everyone loves. Yeah, and so as we've been doing those practices, we've been submitting our data to the Institute for Healthcare Improvement and the John A. Hartford Foundation. And in August, we were recognized as an age-friendly healthcare system.
Oh, very cool. Congratulations for that.
Yeah.
Can you share a little bit more about this approach, the care, and just kind of what's different about it?
Yeah, so the age-friendly approach really focuses on something called the 4 M's.
Okay.
So the M's stand for what matters, mobility, medications, and mentation. So when we talk about what matters, what we're really doing is we are trying to identify what each individual's goals and preferences are and their values so that we can incorporate that into each person's care across the continuum. When we talk about medications, we talk about if a medication is prescribed, we want to be sure that it is appropriate, not causing side effects, is consistent with what matters to the patient, and not creating problems with their mobility or their mentation. We talk about mentation, which is kind of an unusual word, but it's basically things affecting the brain. So we want to be sure that we're preventing or at least identifying early and treating things like depression, delirium, and dementia. And then lastly, we talk about mobility, with the goal being there that we are having people be able to move in their own environments to do the things that matter to them.
Awesome. And how does this benefit then to the people that you're working with?
Yeah, so the benefit, like we said, is improved healthcare outcomes.
Yeah.
But it also, I think, is just important for us to identify what people really want, because it does us no good to offer people health care that's not consistent with what they believe in and what their outcomes want to be.
Okay, sounds good. Well, Dr. Spivey, appreciate you being here today. It sounds like a great program that you guys have.
Yeah.
All right,
Thanks
thank you
so
very
much.
All right, Houston, what's coming up next?